The Kingdom of Lesotho is the first to break the monotony and host the 15th Network African Parliamentary Committees on Health outside Tanzania. Having learned some painful lessons from the recent COVID-19 pandemic, Africa has no choice but to work as one.
Lessons learned from COVID-19 has challenged us in Africa. Therefore, it is important to focus on the strengthening primary health care by employing integrated service delivery approach, which highlights most essential elements such as universal coverage and access, comprehensive person-centered at first contact, which reduce morbidity and mortality among our populations.
We will not rest until our people from Cape to Cairo have access to dignified medical care when faced with ill health. Access to medical care without unnecessary hindrances and due restrictions. We will not rest until our daughters and sons from Kilimanjaro to Tanzania can enjoy their childhood's disease-free lives.
This conference believes that it is crucial to keep the communities at the center and protect them such that they form part of the discussions in terms of the emergency's preparedness and response.
It is important to keep strong logistic systems that would allow medical countermeasures to move to where they are needed. It is important to build the capacities in Africa to be able to produce and maintain the medical countermeasures such as vaccines, such as diagnostics, such as treatments that are essential to handle most outbreaks and health emergencies.
And we are all African continent and we talk the same language on the healthcare systems. We want new innovations. We want to have our own vaccines so that we don't depend so much on the donors.
Ultimate objective is to have the Maseru Declaration that's going to come out of this meeting, and we're hoping that's going to be the flagship of parliaments from all over Africa to say now, as we become a united Africa, this is our tool.
But despite a successful attendance to the conference, many members are simply not pleased with immigration hurdles experienced that saw some members hold up at OR Tambo International under unclear circumstances.
When you go from an African country to another African country, you're going home away from home. It must be home. I would understand if it's a little bit difficult to get into Brazil or a little bit difficult to get into Hong Kong, but to get into Senegal, to get into Uganda, it should not be a problem at all. It is rudimentary. It's a rudimentary problem that should have been buried a long time ago. It should be easy for an African person to go to another African country, especially for members of parliament.
Rapelang Khatebe, SABC News, Lesotho.